Hello everyone. Today we will discuss about a common bowel problem which is called irritable bowel syndrome. The short term is IBS. So let's make a summary first. Irritable bowel syndrome is characterized by abdominal pain, bloating and alternating constipation and diarrhea. The cause is normally unknown, but environmental factors such as changes of the routine, emotional stress, infection, and poor diet could trigger this attack. Treatment options include changing the diet over a period of time, using laxatives to treat constipation, or anti-diarrhea medication to control diarrhea. So now let's have a detailed discussion about irritable bowel syndrome. Now, around 1 in 5 Australians experiences these unpleasant symptoms of irritable bowel syndrome at some stage in their life. These could include abdominal pain, mucus in the stools, and alternating diarrhea and constipation. So people who have IBS usually have a very unpleasant bowel, and if the bowel is very sensitive. And it is interesting that more women than men are prone to IBS, and symptoms tend to first occur in the early adulthood. So like we said, the cause is unknown, but there are a lot of environmental factors could trigger this, such as like the poor diet, stress, infection, and change of the life routine. Now, research has found that serotonin, which is a neurotransmitter, plays important role in symptoms of IBS. Now, serotonin is a neurotransmitter that is released inside your brain and inside your bowel to help you to maintain good mood and good bowel function. So if your serotonin is not released in the proper amount, it could affect the function of the nerve cells inside your bowel and cause changes of your bowel pattern. Now, normally, irritable bowel syndrome doesn't cause long-term damage to your bowel and doesn't cause serious bowel conditions such as cancer or colitis. However, if we do have these symptoms, we could get treatment in the early stage to make us feel more comfortable. So, like we said, the symptoms of IBS include abdominal pain or cramping. Now, this cramping pain normally relieved by passing wind or feces. People also could have sensation that the bowels are not fully emptied after passing stool. So normally, if people have IBS, when they finished passing stool, now they still could have a heaviness feeling in their bowels and feel like they haven't still fully emptied. Patients also could have both diarrhea and constipation. So not only constipation, but actually constipation and diarrhea are normally mixed. Abdominal bloating, mucus in the stool, nausea and vomiting are some other symptoms. Now, what are some causes of IBS? The causes include infection, food intolerance, general like low fiber diet, or emotional stress, or some certain types of medications. Now, with the food intolerance, especially when people have impaired absorption of the sugar, lactose. So there are a lot of people actually they are very sensitive to lactose, and their bowel is not tolerable to lactose. Now, lactose is normally found in dairy and many processed foods. So if people have lactose intolerance, now they could easily have irritable bowel syndrome when they consume these foods. So the best option is to reduce reduce the amount of processed food and reduce consuming dairy product like milk if you do have a lactose intolerance. Some medications like antibiotics, antacids, and painkillers could trigger constipation and diarrhea. So if you have IBS, you should try to control these medications. So I hope this could help you have a bit more understanding about what is IBS and how could we treat it properly. Now, if you do have a serious IBS, now you need to go to your doctor and get a full medical checkup, and especially have a blood test and stool sample collected. Then doctor could send your stool sample and blood to the pathology and test whether there is any virus or bacterial infection, and they could tell you what is really the reason. And if possible, doctor will need to do a colonoscopy or sigmoidoscopy, like sending a tube with a camera at the tip and send this tube into your bowel to see clearly about the internal problem of your bowel. So this procedure is called a colonoscopy or sigmoidoscopy. So like doctor sending this tube into your bowel and then can see clearly what is a problem inside. So I hope really my little lecture could help you to understand a bit more about what is irritable bowel syndrome and how to properly treat it. Thank you.